Well, more now on the province announcing changes to diagnostic testing access. We're joined by the Executive Director of Friends of Medicare, Chris Gallaway. Chris, thanks for taking time for us this morning. And if we can just start with having you explain what exactly the province has changed and your main concerns with those changes.
Absolutely. Good morning. Thanks for having me back. What we've seen yesterday is a government announcement for more American-style two-tiered healthcare in Alberta. We have a government that seems more interested in ensuring there's markets for-profit healthcare delivery than worrying about ensuring Albertans have the care they need when they need it.
And so what specifically in this announcement has you most concerned?
Yeah, what we're seeing is that the government is going to allow Albertans to go pay for all sorts of different diagnostics out of pocket to decide themselves if they want those tests. And then, if it's critical, they can come back into the public healthcare system, maybe get reimbursed and go from there. So we're really just seeing a scenario where those with money are going to be able to pay to access care, to skip the queues for waits and get care sooner and faster than other Albertans. And we don't think that's fair, and it's not in line with the principles of public health care.
The province is arguing this will lead to more private operators entering the system, which it says will be good for access.
Yeah, every time the government announces one of these privatization schemes, they claim it's going to save us a bunch of money, increase capacity, and shorten wait times. And that hasn't come true anytime they've done this. We can look at the surgical initiative that has blown up our workforce and made surgery waits longer for a lot of Albertans. It's lowered our capacity. We can look to DynaLife, that super failed privatization to community labs that we paid over $100 million to buy back, and we're still waiting for the Auditor General's report into that contract. And now we're doing it with diagnostics. So, do it over and over again, claim it's going to solve the problems, and then it fails. So why are we trying it yet again now with diagnostics?
Chris, Alberta is already missing out on millions of dollars in transfer payments from the feds because of some of these moves to private delivery. Does this have the potential to lead to more dollars lost?
Yeah, absolutely. We're seeing clawbacks, millions of dollars clawed back from the federal government because we're not ensuring that Albertans aren't paying out of pocket for medically required services, something that's illegal under the Canada Health Act. We're supposed to have equal access for free with no out-of-pocket costs. And there's been solutions put forward to them to solve this problem. We saw a 2022 report from the Auditor General that laid out how we could use diagnostics that are not currently being used in the public system, how we could more effectively schedule and use those tests. And we're not seeing any action on that. Instead, we see a government that's only looking to adding for-profit operators and including more out-of-pocket costs for Albertans, which directly violates the Canada Health Act.
Yeah, so in terms of that Federal Health Act, we're seeing some of the money clawed back. Are there other ways that eventually gets addressed? Are there challenges that could occur if this pushes the line too far?
Yeah, we're curious to see what the act actually says. Yesterday, the government announced that they would be tabling new legislation in the spring session. But, the details will matter in what they actually table in terms of how it's in line with the Canada Health Act. The federal government will likely have an opinion on that. But the biggest recourse we can see under the act is losing out on federal health transfers. We're already losing out on millions of dollars because of MRIs, CTs, and diagnostic testing and our approach to it. So if we escalate that approach or go to this whole new system where folks are paying millions out of pocket to access these tests, we're really worried about what that means for our federal health transfers coming to Alberta for public health care, for equal access to that public health care.
Now, the province does say there will be a consultation process before this is put into effect, or the legislation, I guess, is put forward. Are you expecting to be given an opportunity to express your concerns?
Well, what we've seen with many of these changes, the massive restructuring and so on, is they announce it, they put the legislation forward, they pass it, and then they consult after they've done all the work. So we don't expect to be heard on this. We don't expect the frontline healthcare workers and others concerned about this change will really be listened to, because so far the pattern of this government is to make the change, have a little town hall afterwards, and claim they consulted.
Okay, we've got Minister LaGrange up next hour. We'll ask her some of these questions. Chris, very much appreciate your time this morning. That is Executive Director of Friends of Medicare, Chris Gallaway.